We use our hands for everything. We cook, we write, we even talk with our hands. That's why it can be so crippling when people develop essential tremor, a disorder that causes parts of the body to shake. All of a sudden, you can't even take a sip of water without spilling half of it. And while there are treatments, the options aren't always pleasant. Patients can either choose between doctors drilling into their head or taking medication that may or may not work.
The medicines really can be quite effective, but generally in only about half of the cases. And even if they're effective early on, this is a slowly progressive disease, so the tremor gets worse and worse over time. So sometimes the medicines can be effective when the tremor is slight, but then their efficacy wears off.
That's Dr. Reese Cosgrove, Director of Epilepsy and Functional Neurosurgery at Brigham and Women's Hospital in Boston. He says he only considers brain surgery for tremors if they're affecting a patient's quality of life. The procedure has changed over time, where now surgeons commonly implant electrodes into the brain. The patient is then able to change the electrode stimulation in real time, getting rid of their tremors in one hand. However,
the disadvantage of deep brain stimulation is invasive, and you can see hemorrhages in the brain. And of course, you have permanently implanted hardware, which can get infected, and then everything has to be taken out.
The procedure is effective, but many people don't want to risk brain surgery. Instead, Cosgrove is now using a new non-invasive treatment called MRI-guided focused ultrasound. All treatments for ET are currently only FDA approved for use on one hand. Cosgrove says the procedures lose accuracy when operating on a second hand.
I tend to use the focused ultrasound for my older patients who are probably too old or at higher risk for deep brain stimulation, or there are certainly some patients who just don't want to have invasive brain surgery, or they don't want to have permanently implanted electrodes in their brain and in their body.
Jack Winegard was one of those people. After battling with essential tremor for 5 years, Winegard's medication wasn't doing much to help.
Just carrying a glass with the drink, it'll spill all over the place. I couldn't write anymore. I couldn't do my checkbook. I couldn't sign cards. I couldn't do anything. We would go out to grab something to eat. I would have to have my husband, Bert, like put pizza on my plate or do this. But even taking a fork and trying to eat a salad, I couldn't do that. So if we went out, it had to be someplace where, like, if I could grab a hold of a sandwich, I would be okay. But to lift a drink or carry a drink, let's say like from, wherever you go get a fountain drink, I couldn't even carry that. He had to do it all for me.
So Winegard went looking for a solution that did not involve drilling into his skull. One of his doctors told him about the focused ultrasound treatment, and soon he was making a trip to Dr. Cosgrove in Boston. Cosgrove explains that the procedure is done on an outpatient basis, which means you're in and out the very same day.
It takes about 2.5 hours, but there is some unpleasantness involved. We have to shave the whole head, which that's an obstacle to some people. We have to affix a stereotactic frame to their head as well, so we have to inject some local anesthesia. That's about 10 seconds of unpleasantness for sure, but that goes away, and that when the scalp is numbed up, then we affix the frame. It's a bit like going to the dentist, but being stuck 4 times.
Then the patient is put into an MRI machine for 15 to 20 seconds, and sound waves are sent into their head. The waves create a small lesion in a very specific part of the brain.
I came out of the machine. They gave me a can of soda to drink to see how much I would shake. And they also gave me a pad to write on. And he gave me words to say. I had to follow what he said. And then they put me back in the machine, and they did it again.
Winegard says this cycle lasted 3 or 4 more times before Cosgrove deemed it a success.
So I held my right hand out, and it was steady as can be. And that's something I have not experienced in 5 years. So I was thrilled. I was absolutely thrilled.
And though Winegard didn't feel any pain during the procedure, Cosgrove says some patients do report temporary headaches or heat on their head. Those go away once the treatment is over, but different side effects can pop up afterwards.
Remember, we're operating on the brain. We're just operating on the brain with sound. It's still brain surgery. I tell all my patients, this is still brain surgery. It's just no-touch brain surgery. So we don't have any of the standard risks of brain surgery like bleeding or infection, the requirement for anesthesia, but we're creating a little lesion deep in the brain, and this is high-price territory, of course. So many patients will have some temporary and mild side effects.
While many of his patients experience these side effects, Cosgrove says most of them say it's worth it to have their quality of life dramatically improved. It certainly has helped Winegard.
I eat dinner at home, and I eat salads and everything, and there's no shaking, and I eat my cereal, and there's no shaking. I can carry a glass of water without the water spilling out all over the place. It just gives you more control. It gives you more control over just little simple things. You know, simple things that you take for granted. Until you have tremors, essential tremors, you don't really realize how important your hands are.
Cosgrove and his physician assistant, Sarah Christie, have done about 250 procedures together. He says patients can get very emotional once the treatment is over. They're finally able to regain control after years of being disabled by the shaking.
Patients will come in the next morning after we've done the surgery, and their hand is steady and fit, and they haven't seen that. And they all get a little teary. And, older, grumpy old men, don't get emotionally welled up about stuff. But when they realize that, wow, this really worked, they all get a little teary. So that's why Sarah called it the operation that makes grown men cry.
Cosgrove says this new procedure can help more patients than just those with essential tremor, since the FDA has also approved focused ultrasound treatment for those with Parkinson's disease. You can find out more about Dr. Reese Cosgrove and all of our guests at our website, radiohealthjournal.org. For more behind the scenes, search Radio Health Journal on Facebook, Instagram, and Twitter. Our writer-producer this week is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
People pine for love, they kill for love, they live for love, and they die for love. It's a very profound system.
Experts say love is a natural addiction. We need to eat, we need to drink, and we need to love.
Then how breast cancer patients are being targeted by the beauty industry.
I would say probably 75% of the patients that I treat who have had these procedures have a worsening of their symptoms.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Even if you're in a company where you're not being experimental, you can bet that one of your competitors is.
The different ways we work post-pandemic. Then,
if we can take control of the cues we send, if we know exactly what to do with our hands and our body and our face and our voice, that's actually a way that we can cultivate an authentic sense of charisma.
Recognizing the small cues that can make a big difference. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.